up is the I in Learn to Swim, and this is for the INI1 lost tumors. And INI1 is also known as SMARCB1. Primarily the one that's going to be a small round blue cell tumor is malignant rhabdoid tumor. That's going to occur in soft tissue locations and the kidney. Somebody saw the grizzly bear on the left side. That's great. ATRT is kind of the CNS cousin of malignant rhabdoid tumor. And then several other things can have INI1 loss, but they're not really histologically too similar to malignant rhabdoid tumor. So we'll talk a little bit about malignant rhabdoid tumor here. So malignant rhabdoid tumor, often this is going to occur in the first 3 years of life, rarely up to age 10. Mostly these are going to be in either renal sites or extrarenal sites, but renal sites tend to be more common. And histologically, that rhabdoid name comes from the prominent eosinophilic cytoplasmic inclusions you're going to see in these tumors. So because they have that rhabdoid cytology, you're going to want to differentiate that from rhabdomyosarcoma. Wilms, after it's treated, can have some rhabdoid differentiation. Synovial sarcoma can have rhabdoid differentiation. And renal medullary carcinoma is also going to have rhabdoid features, but it's going to present in older kids. By immunohistochemistry, the really characteristic thing is that INI1 is completely absent. Unlike synovial sarcoma, where it's just decreased in the tumor cells, you're going to have biallelic inactivation of INI1 that's going to lead to a complete lack of that protein in the tumor cells. And it's going to be negative for desmin and myogenin to help you distinguish it from rhabdomyosarcoma. Now, the important thing to know here is that patients who have this tumor may have a germline predisposition, and that germline predisposition is based on the fact that they have inherited an altered allele of INI1 or SMARCB1. That altered allele, having lost one copy already, leaves them at in a predisposition to have a genetic injury to the other allele and end up without either allele, and that would result in a tumor. So histologically, as you might guess, these tumors have this really prominent rhabdoid cytology with abundant cytoplasm. They tend to be arranged in these nests, and you can see at higher power, here's this really nice rhabdoid cytology where you see a lot of this pink cytoplasm pushing the nucleus off to one side of the cell. Here it is again at high power. You can see this cytoplasm is, as opposed to Ewing sarcoma that was more frothy and clear, this tends to be much more solid and pink. And by immunohistochemistry, here's INI1. You can see the tumor nuclei are completely blue. It's only the counterstain, but you still see brown. You still see reactivity in the endothelial cells and normal cells that are trapped in the tumor. So malignant rhabdoid tumor, most of these kids are going to be the first 3 years of life. That eosinophilic cytoplasm is really going to be a great clue to what this is. And once you do some stains and you see that it loses INI1, you're going to be there. You may want to counsel these patients about germline testing to see if they have a predisposition syndrome. And actually, if you see a patient who has 2 tumors at the same time at presentation or has an ATRT and a soft tissue tumor, that's somebody who's really likely to have a germline predisposition. All right, so let's pause at Red Rocks and see what we have in the chat.